My name is Adrian, and I'm going to be your nurse practitioner today. I am going to complete a head to toe assessment on you. Is that okay? Okay. I'm going to just wash my hands and place on some gloves. I'm going to start by assessing your head, checking for any lesions or nodules. Throughout this exam, I will be assessing your skin, looking for any bruises, breakdown, nodules, masses, anything like that, okay? So next, I'm going to assess your eyes. I'm going to just look at them first. I'm going to look at your conjunctiva, pulling your eyes down, and I'm going to lift your eyelids upward. So now I'm going to have you look at the tip of my finger, and without moving your head, follow my finger. During this part of the exam, I'm going to look for nystagmus as well, which is just your eye shaking. Now you're going to look forward and look at the tip of my finger, and don't move your head. Next, I'm going to test your vision. Can you cover one of your eyes? And can you read the eighth line?
372846.
Okay. And you're going to switch eyes.
372646.
Okay. And now I'm going to check the arteries and the veins within your eye. I'm going to flip off the light switch, okay?
Okay.
And you're going to look forward. And I'm going to move forward towards you. You're going to turn the light back on. And now I'm going to palpate. I'm going to assess your nose. I'm just going to feel the bridge of it. Can you close one nostril? Sorry. Can you close one nostril and take a deep breath? And now do the other nostril. I'm going to look inside your nose. And now I'm going to test your sense of smell. Can you close your eyes? I'm going to hold something up to your nose, and then I want you to tell me what it is. Can you close your left nostril, please?
Marker.
Now repeat with the other nostril.
Marker.
I'm now going to take a listen to your ears. Can you push your hair behind your ears? I'm going to look at your ears. ears now. And I'm going to do the same on the other side. Going to look at your ear. And now I'm going to take a listen. Look through it, okay? I'm going to test your hearing. I'm going to go stand behind you and I'm going to say 3 words and I would like you to repeat them for me, okay?
Dog, cat, bat.
I'm now going to do the Weber test. I'm going to place the tuning fork onto your head and you're going to tell me if you can hear the sound or in vibration on both sides, okay?
Yes.
I'm now going to do the Ryan test. I'm going to place the tuning fork behind your ear. You're going to let me know when you stop hearing the sound. Then I'm going to move the tuning fork next to your ear and you're going to let me know when you don't hear the sound, okay? I'm going to place your ear behind your ears.
Okay.
I'm going to do the same thing on the other side.
Okay. Okay.
I'm now going to look inside your mouth. And before I do that, I'm just going to check the muscle in your jaw. Can you bite down for me? Make a chewing. Perfect. All right, I'm now going to have you open up your mouth. And can you repeat the ah sound for me? And now can you cough? One more time. And can you smile? Can you frown? Can you puff out your cheeks? Can you blow air? Can you clench your jaw shut? Now can you stick out your tongue and move it side to side and move it up and down? And now I'm gonna grab your tongue and I'm just gonna lift it upward. Okay. I'm gonna change gloves. I'm now gonna assess the lymph nodes of your neck. And I'm just gonna run my fingers in a circular motion. And I'm gonna go down your shoulder line, back up it. I'm gonna move up the front of your neck. I'm gonna come under your jaw and go back. And then I'm gonna come down the front of your neck again and go down your clavicle area. I'm going to check the range of motion in your neck, and I'm just gonna have you copy after me. So we're gonna bend your head down, and we're gonna bring it back, and we're gonna go to ear to shoulder, ear to shoulder. Can you turn your head to the left, and then turn your head to the right? Can you turn your head towards my hand? And turn your head towards my hand. Can you lift your shoulders up and bring them back down? And now do it against my hands. Perfect. So now I'm going to check your cranial nerve reflex, and I'm going to touch your face with either something soft or something sharp.
Okay.
Is this still recording?
So it's still green.
Something soft and something sharp. I'm gonna have you close your eyes and you tell me where you feel it at, okay?
Okay. Left, soft. Right, soft. Right side, soft. Left side, soft. Left side, sharp. Right side, sharp. Right side, sharp. Left side, sharp. Left side, soft. Right side, soft. Left side, sharp. Right side, sharp.
I'm also going to assess your taste. Can you stick out your tongue one more time? You're gonna close your eyes, and I'm gonna drop something on the left side of your tongue. Can you tell me what that tastes like?
Peppermint.
Close your eyes one more time,
Okay.
and I'm gonna drop something on the other side and tell me what it tastes like. Stick your tongue out.
Peppermint. I'm like, did it get on my tongue?
No. Okay, now I'm going to listen to and inspect your lungs. Just looking at your chest rise and fall, and now making sure you're symmetrical. And ma'am, can you turn towards the camera so other way, so your back's sort of just a little bit. And can you take a deep breath for me? And one more time. Perfect. And now, can you say the dog will walk?
The dog will walk.
And one more time.
The dog will walk.
Okay. Okay. And now, ma'am, I'm going to listen to your lungs. Every time I move the stethoscope, I'm going to take a deep breath, okay?
Okay.
Now I'm gonna, could you whisper the dog will walk 4 times, okay? Now can you repeat the letter E? Thank you. Can you lift your left arm above your head? And now your right arm above your head. And now I'm gonna listen to the front. Can you turn towards me? In a normal patient setting, this would be done with skin to skin contact. I'm now going to listen to the front of your lungs. Okay, and now I actually skipped something, so I'm gonna go back and do it. In a normal exam, I would be able to do that. So, let me turn towards the back a little bit. I'm gonna percuss and listen to the. I'm gonna percuss. I'm going to listen and mark where your lung sounds change at and make sure they're even on each side. Okay. Ready? You can turn back towards me. And now I am going to assess your heart. Can you turn that way a little bit? And again, this would be done skin to skin. So I'm going to look and I'm going to take a look at you. Everything is looking okay. I'm feeling for any thrills. I'm going to find your maximum point of your heartbeat. That feels okay. And now I'm going to listen to the 5 places of your heart. And I'm going to listen here. I would listen at the apical heart rate for a minute or for 15 seconds and then times it by 4. Alright, I'm going to have you lay supine on the bed. And I'm finding the maximum point of your heartbeat again. And here I'm going to repeat and I'm going to listen to here for a complete minute. The minute is now over. Can you rotate onto your left side? And again, I'm going to find your maximal point where your heartbeat is. And I'm going to listen there for the full minute. Okay, the minute is now up. And can you sit back up? I'm now going to assess your blood vessels. I'm going to look at your neck for any vein distension. I'm going to feel for your carotid pulse. Gonna feel, can you hold your arms out? Gonna feel for your brachial pulses. And then your radial pulses. Can you hold your hands out? Looking for your capillary refill and checking your skin for edema. I will check your femoral pulse. I'm going to check your popliteal, your pulses behind your knee. And now I'm going to check for the pulses in your feet. I'm checking your capillary refill on your feet. And I'm also going to look for edema on your legs as well. All right. And now now, ma'am, I'm going to have you lay back and I'm going to assess your abdomen area. I'm just looking at your abdomen, and now I'm going to listen for your bowel sounds. All right, and now I'm going to kind of tap on your body. I'm looking for your liver, okay? I'm going to do the same thing going up your belly. And it's located in this area. I'm now going to press lightly on your stomach. Tell me if you feel any pain or if it hurts while I'm doing this, okay? Did you feel anything? And now I'm going to press a little deeper. Did you feel anything that time? Now I'm going to feel for your liver, okay? Tell me if at any point I'm hurting you. And now I am going to um, look for your right kidney. I'm going to lift you up with your back. And my top here, I'm going to press. You're going to feel me pressing kind of hard. Just let me know if I'm hurting you, okay? And now I'm going to check for your left kidney. I'm going to do the same thing. I'm going to lift it up. And now I'm going to check for your spleen, okay? All right, ma'am, you can now sit up and turn your back towards the camera. I'm now going to check your kidneys, okay? And please let me know if this hurts. I'm going to do the same thing on the other side. Let me know if it hurts. And you can face forward. So I've done the range of motion in your neck. I'm now going to assess the range of motion of your hands. I'm going to check the joints as well. At any point, let me know if this hurts. Yes. And now I'm just going to have you copy after me. You're going to hold your hands out. And now we're going to bend the fingertips down. And we're going to bring the fingertips upward. Now flap that wrist down and flap that wrist up. We're going to go back in the normal plane. Turn it inward. Turn it outward. Back in the plane. Spread your fingers. Make a fist. And then bend your thumbs. Perfect. And I'm going to assess your feet. So you're going to push your feet towards the sky and then press down on the gas pedal. Turn your feet inward, turn your feet outward. Um, spread your toes, spread your toes. Yep, that's it. And now I'm going to have you stand up, and I am going to check your hip and spine area. Alright, I'm going to have you bend over and touch your toes, looking at your curvature. You're going to stand up, and then you're going to, oh, you can face me now, sorry. You can lean to the side, and then lean to the other side, and then we're going to go back, and then, well, this is just for fun.
Okay.
Okay, ma'am, you can now sit back down. I think that's it. So, okay. Now I will explain the female breast and male breast exam. I would start with the patient in the sitting position, and I would inspect the breast for size, symmetry, contour, texture, and shape. I would inspect the nipples and the areolas for size, symmetry, texture, inversion, and eversion. I would have the patient do this in the following positions. Can you place your hands on your hips? And you're going to press your hands against each other. I would have her put her hands over her head. And then I would have the patient lean with her hands away from her waist. And I would inspect the breast, the nipples, and the areola doing both of those, all 4 positions. I then would inspect the breast for superficial nodules by doing the swiping method. I would start at the mid-clavicular line and swipe my hand across the breast until I reach the sternum, and I would do that on both sides. I then would feel for deeper nodules by taking one hand and placing it up under the breast to lift up the weight in the tissue, and then taking my fingers and walking my fingers across the breast. And I would do this on both sides. I then would have the patient lay down. I would place a pillow behind the shoulder of the breast that I am examining, and then I would use the vertical stripe method to palpate. This means that I would take my fingertips and start at one side of the breast and move down in a vertical direction across the breast and move back up in a vertical direction going across the breast. I would have the patient sit back up, and then I would support the patient's arm, have the patient flex their arm and support it. And at this time, I would assess for the axillary nodules. I would take my fingertips and move them into the axillary hollow and palpate. I would move down towards the brow line, down the medial part of the axillary, and down the posterior part of the axillary, looking for any nodules. I also would assess the nodes of the supraclavicular nodules and the infraclavicular nodules by hooking my fingertips in the hollow of the clavicle and palpating in a circular motion. At this time, the breast exam would be complete. Next, I would do the exam of the female genitalia. I would have my patient put her legs into an end position and scoot her buttocks to the edge of the bed and place a drape over her legs. I would now do the external part of the exam. I would inspect the labia majora and the labia minora. I would then open up the labia minora to examine the other areas. I would inspect the clitoris and notice size. I would then inspect the urethral meatus and the vaginal introitus. I then would take a finger and slide it into the vagina. I would then take a finger and slide it into the vagina and move a second finger in as well. I would press upward and milk the skin gland by moving my fingers outward. I then palpate the lateral walls. I would palpate for the Bartholin's glands on both sides of the vagina. I then would have the patient squeeze my fingers and assess for muscle tone. I then would remove my fingers. I now would do the internal exam. I would look for the speculum that would properly fit the patient, and I would lubricate it. I would then explain what I'm doing to the patient, of course. I would slide one finger into the vagina, pressing downward. I slowly would enter the speculum into the vaginal canal, into the vagina, the length of the canal. I would slowly open up the speculum until the cervix is in view, and I would adjust my lighting for a better view as necessary. I then would assess the cervix for size, shape, length, and I guess that's it. And once I saw the cervix, I then would note all of that and slowly remove the speculum. And while I'm doing that, I would inspect the walls of the vagina. I now would do the bimanual exam. I would slide 2 fingers into the vagina and palpate the walls. I would try to palpate the cervix, noting the size, the direction it's in, the contour of it, and I would move it side to side to check for the mobility. I would then use the 2 fingers to press upward, feeling for the uterus. I would take my free hand, placing it on the abdomen and pushing downward and inward while pushing the other hand upward to feel for the uterus. I would note the size, the shape, the contour, and attempt to move it to check for mobility. I then would move my abdomen hand into the right lower quadrant and press downward and inward, checking for the ovaries. And then the bimanual exam is done. I now will do the vaginal anal exam. I would change gloves, and then I would insert my pointer finger into the patient's vagina. I would tell the patient to bear down and then to relax. As the patient relaxed, I would slide my finger into the anus. I then would tell the patient to bear down again and to relax. As the patient was relaxing, I would slide my fingers in deeper. I would palpate the lateral walls of the anus. I would have the patient squeeze to check muscle tone. Then I would rotate my finger and palpate the anterior wall of the anus. I then would take my free hand and place it on the abdomen, pressing downward and inward. And with the finger in the vagina, I would try to assess the posterior wall of the cervix. I then would slide my fingers out, and as I was sliding out, I would palpate the posterior wall of the anus. I would check any stool that is on my glove for color and consistency. I would check the anus and the perineum. I would inspect the anus and the perineal area for any lesions or nodules, discoloration, and things like that. That concludes the exam of the female genitalia. I now will assess the male genitalia. I would start by looking at hair distribution on the male. I would inspect the penis, looking for the dorsal vein, and noting whether the patient is circumcised or uncircumcised. I would then inspect the urethral meatus by pressing the head of the penis between my fingers so that it opens up. If the patient is circumcised, I would gently pull back the foreskin to reveal the urethral meatus. I then would palpate the penis for any nodules, masses, or lesions. I would lift the penis back so that I could inspect the scrotal area. I then would have the patient stand up, and I would tell the patient to bear down so that the inguinal canal is more visible. I would then take a finger and move it into the scrotum up towards the inguinal canal and have the patient cough. If I felt any bulging, I would note a hernia. I then would remove my finger and palpate the testes and the vas deferens. I then would take an object and check the cremaster reflex by sliding it up the patient's thigh, looking for the scrotum to move up. I would do this bilaterally. Next, I would inspect the anus and the prostate of the male. I would have the male turn around and lean against the examination table to have a better view. I would open up his buttocks and examine the anus and the perineal area. I would lubricate my finger. I would have the patient to bear down, and then I would tell him to relax. As he relaxed, I would slide my finger into the anus. I would palpate the lateral walls. I would rotate my finger upward to palpate the anterior wall. I then would return it down and attempt to palpate the prostate, noting any protrusion or enlargement. As I removed the finger, I would palpate for the posterior wall. Once removed, I would check the glove for stool, noting the consistency and color. At this time, the male genitalia exam is complete. I think that's it. Thanks.